Hi, I'm Dr. Petty with Carolina Chiropractic. Today I'm here with a tennis pro who works at Pinehurst, and she's going to talk a little bit about what she's seeing me for.
Yeah, so for 5 or so years, I've always had neck pain, and I went to the doctor recently, and turns out I have arthritis, and maybe it came from overuse of playing so much tennis and whatnot, and just I'm trying to not have that pain every day.
Okay. And you had tried chiropractic once before, right?
Right, when I was younger.
When you were younger, and that seemed to help in the past or whatever else, so you figured that you tried again.
Right.
You've done some PT for this, correct?
I have, yes.
Okay, and you're doing your exercises and stuff, but you were like, I needed something a little bit more, a little bit different, right?
Right.
Okay, all right, and that's what drove you to our office.
Okay.
I don't usually discuss what the exact level is on YouTube. You know what it is, we've talked about it, or anything like that. But yes, you have a little bit of arthritis, as you mentioned, in your neck. And it has caused some aches, some pains, things of that nature. It's affecting your tennis game, correct?
Yes.
Okay, like it's making it harder for you to play. You're able to still teach lessons, correct?
Right, it's harder to take go my full swings, and it kind of hurts that.
Okay. Okay. And is that full forehand or full backhand?
More forehand.
Okay.
Mm-hmm.
All right, just curious. So what we're going to do is we're going to also adjust her shoulders and her neck, and talk a little bit about that. And I usually KT tape your neck at the end of it. And then I was going to do a little traction, add in that today to your routine. I may not put that on the video though.
Okay.
Just relax the elbow right here. We're going to kind of pull back. Nice and easy, kind of relax, right? Good. You feel that little click, that little pop. It's nothing super loud, nothing super crazy. But it just kind of helps loosen the shoulders back up, and kind of helps everything feel better. So what we're gonna do, just kind of reassess since the last time that I've seen you. You've tried playing tennis since you saw me, correct?
Correct.
You said, for the most part, you can, but the muscle that you had pulled in the back was kind of bothering you a bit, right?
Right.
Okay. I wouldn't try to play you in tennis. I would get destroyed. I am not a tennis player. Right, take a deep breath in and all the way out. I will humbly, gladly say that I would not win that match. But that would practically go for anyone that I play in tennis too. So,
Okay.
All right, take a deep breath in for me, and all the way out. Nice and easy. Good. Good. All right, Dylan. We're gonna come right here, loosen it up just a little bit, nice and easy. Relax, right? Good. Relax, right? Good. You okay?
Mm-hmm.
All right, straighten the bottom leg. Good. Bring the top one up. Kind of roll towards me, nice and easy. Good. And roll to the other side for me. Good. Nice right there. Good. And line it back for me. All right, and we're going to cross the arm. Look that way for me. Good. Breathe in and all the way out. Good. All right. How'd that feel?
Good.
Good. And you feel all that tension up there in the suboccipitals. I'm getting up in the back of the neck right in here. I know it's really kind of hard for you to see on the video, but you feel that tension, right?
Mm-hmm. Yeah.
Feels kind of good, but also a touch painful, correct?
Right. Yeah.
Okay. I'll take that light out of your eyes just a little bit and dim it. Okay. You okay?
Mm-hmm.
Good. Tell me if it's too much. And we'll stretch it and adjust your neck in just a second. To traction it out a little bit. That's not what I was necessarily talking about with the traction piece. We're going to use a mechanical traction device for the neck. But how's that feel?
It feels good.
Good. All right. And so we're going to kind of stretch you there. You okay?
Mm-hmm.
Good. You look over your left here, relax, right? Good. Look over your right. Relax that muscle, right? How'd that feel?
Good.
Okay. Sit up for me if you don't mind. Move that head, neck around, tell me how it feels.
Feels good.
Okay, all right. Cool. All right. So now I'm going to KT tape her. I'm going to spray with alcohol to take off any lotion, sweat, or anything like that that she may have on her neck. And then we're going to just kind of tape this neck to help it feel a bit better and kind of support the muscles. I cut 2 small strips around the edges a little bit, and then you just tear it like you're tearing paper. It makes it easier to use. You want to go up underneath this hair and underneath the necklace and all that fun stuff. You don't want to tape any of that underneath it, obviously. Then we're just going to kind of take it like that and flip it right there. And it's going to go down at an angle. And what you really want to do is kind of roll down, if you know anatomy, down levator scapula. At the top, there's no stretch. In the middle, there's going to be about a 15 to 20% stretch. And so you're going to kind of come down, basically aiming towards the shoulder blade. And kind of come all the way down in here. And then at the end, there's no stretch. And I'm all the way down here when I finish. If you know anatomy, the spine of the scapula, we're going to kind of come all the way to that point. And so that kind of creates it. Rub the back of your hand because you don't want it to, you want it to stick. I did while I was doing that, trying to make sure that you could see. I did get a little, sorry, this is going to be a little tender, a little crease in there. If you leave the creases in there, they will catch dust, lint, etc., sweat, and it will rub a blister. You do not want to leave a crease in there. If you have to redo the whole piece of tape, that's better than getting a blister from it. Again, you just tear it like a piece of tape. Now I'll flip this up. I appreciate you doing this video with me today.
Yeah, of course.
So, I'll pull down. Again, about a 15 to 20 degree stretch in the middle part. And no stretch at the ends, okay? And then you just kind of rub it a little bit. And this is that simple. And now it kind of feels a little supported and everything else, right? If you're swinging hard at the ball, forehand, backhand, etc., it will be supported. It won't cause that shoulder to hurt or that neck to hurt.
Okay.
All right, thank you.
All right, thank you.
All right, thank you. Comment, like, subscribe, and we'll keep doing the videos.